guys meet? Yeah, we said hello. Okay. Where you from? Come on, you know me. Where you from? You know me without any hair on my face. No. I'm from Stanford. Okay, perfect. Glad you guys are friends. Are you guys talking? Are you guys friends? Everyone friends here? Did you get him? Okay, all right, that's enough chit chat. Um, real quickly, before we bring up our next panelists. All right, everyone, simmer down. Thank you. I'm glad you all have friends now. What were one or two takeaways from the amazing panel we just had? Anybody? Yes, sir. Women's health is important and it's very much ignored. Thank you so much. Anyone else? Anyone else have a takeaway from the last panel? Yes, miss. We are all investors in our own health. Perfect. All right. Max, you ready? Ladies and gentlemen, please welcome to the stage Max Marchione.
Actually, I have a mic. I probably don't need that mic, hey? Cool. Can you all hear me? Great. Well, excited to be here. We're going to be talking about, if it clicks, nope. Can we put my slides on? We're going to be talking about Weiwu, PhD. No, let's wait for the slides. No, the slides that I'm talking about. Okay. Great. So, whilst we wait for the slides, we're going to be talking about how to build a longevity company. That's kind of the title. And the general idea will be how to explore the ground truth of the reality of what it looks like on the ground to build a longevity company, right? We've been at this for 3 years now. We're doing reasonably well, and we'll step through what works, what doesn't work, how to succeed, what are the pitfalls, and kind of create a map of the market when the slides actually come up. So let's give it a moment. Yeah. Okay, there we go. Cool. So how to start a longevity company. And my general tenet with this stuff is how do I provide you with information that is non-obvious, right? Something that you're not going to find on ChatGPT. And that means that as much as possible, I'll try to share my opinions, my simple frameworks that inform action. And it's really important it informs action, because if you leave here today not knowing or doing anything different, I've wasted your time. And in particular, I'll try to focus on the real version, not VC gobbledygook. So sorry if there's VCs in the room, you might not like everything I say. So let's start with this question of what actually is a longevity company. And I'd contend that longevity is a bit of a stupid category. And the reason why is it's vague and broad and imprecise. We use this word longevity company to mean all of these things: diagnostics, therapeutics, marketplace, longevity clinics, consumer goods, health language models. Like, it's a lot in one category. And even if you dive into one of these categories, take diagnostics, we have 4 completely different diagnostics companies that we, for some reason, try to group in. We have a commoditized wrapper on a lab. We have a commodity where they actually own the underlying diagnostic like Pronuvo. We have an instance where they own the software like Neko. And then we have proprietary biotech like Grail. And that is diagnostics within a broader category of longevity. Confusing, right? So let's try to simplify. I contend that there are 2 kinds of longevity companies, and that by simplifying, we can guide our thinking and guide our actions as a result. And those 2 kinds are consumer or biotech. And for each of these kinds of longevity companies, there's 2 different ways to succeed. There's 2 different pathways. And I contend that if you understand this, you have a better chance of building one of these companies, investing in one of these companies, operating one of these companies. So for each of those, for consumer longevity and for biotech, we'll step through the short-term playbook, the medium-term risks, what are the pitfalls that come up after the short term, and then how do you get through those pitfalls to the longer-term opportunity? Where the longer-term opportunity is how do you go from $1 billion company or a $5 billion company to something far, far larger than that? So consumer longevity is a start. These companies I'd group into consumer longevity, and they all seem very different, right? And they all seem like they have different business models and different products. And yet I'd say that they all follow the same kind of playbook. When you actually go to the base reality of how these companies work, they follow a similar playbook, which looks a little bit like this. And there's a lot of words, so we'll step through this. But the short is that these companies start by finding something that can grow. And that means they have to pick the right product that allows for a CAC arbitrage, and they have to win with superior marketing. And that's the short-term bet these companies make. And then they stack multiple of these bets on top of each other for long enough to either vertically integrate, become a brand, or become a platform. Now, there's a lot there. So we'll step through it one by one. So first is the short-term idea of how do you actually start with a hypothesis around a kind of product that is conducive to growth, right, as a starting point. And there's this question I often get, what matters more, product or growth? And let's play with for a second the idea that growth matters more. Growth matters more than product, which people aren't going to like to hear. VCs definitely aren't going to like to hear that. And the reason why is that if your contribution margin is greater than your CAC, if you make more money from your users than it costs to acquire them, you can scale infinitely, which is pretty great, right? For every dollar you spend, you get more than $1 back. The catch is that product is the number one way you do that. If you pick the wrong product, you're probably not going to be able to grow. And I contend product is game selection. So product is the game you choose to play, right? And game selection is the starting point for growth. Take Hims. If Hims decided you took that entire team and they all tried to sell vitamin A supplements, they're not really going to be doing the same as they are today, selling GLP-1s, vertically integrated, owning CGMP certified pharmacies, etc. So the short-term strategy so far for consumer longevity is 1, choose the right game, and 2, find a CAC arbitrage to actually allow you to grow. So let's explore those two. Choosing the right game. My recommendation here is start with a category that works. Right? If we go back to the slide I had of all of the consumer health companies, most of them focus on a category that works, right? So that's maybe like one pointer to choose the right game. And then if we look at find a CAC arbitrage to grow, honestly, typically these companies grow via paid ads. Over the past month or so, I've tried to spend as much time as possible with friends who have built billion-plus-dollar consumer companies. And I've tried to see what do they know? How have they built billion-dollar-plus consumer companies in under 5 years? And often what it is they choose the right game and they find a CAC arbitrage with paid ads. VCs will tell you organic, UGC, referrals, viral, owned media, PR, all of this stuff. And it matters, don't get me wrong, but it's not as scalable as finding a paid channel where you have an arbitrage. Now, that obviously creates medium-term risks, right? Your CAC increases, your margins compress, it's a competitive race to the bottom, the business model stops working, and you have all of these supposedly smart people saying, I told you so. These businesses were really shit. Hims is just a commodity pill mill. They're just like pushing these meds you can get anywhere. This company is just a blood testing wrapper. You have all of these like so-called smart people telling you why this short-term consumer strategy didn't work. So that's the medium-term risk. Now the catch is many of these companies are actually using that short-term bet to get to some longer-term game that they're playing, right? So let's actually explore what is the game these companies are playing in the longer term. So there's 3 options and 3 pathways for these companies longer term. One is to vertically integrate. You start small, you stack multiple CAC arbitrage bets on top of each other to get enough scale to now earn you the right to vertically integrate where you compete on cost and quality. Apple did this. Apple started with all sorts of OEMs, third parties. Now Apple owns basically the full stack. Hims did this. They started as a wrapper on a pharmacy. Now they own pharmacies. They make their own compounded, personalized formulations. Maybe in the limit, Hims personalizes a single drug for a single person. Everyone has a personalized version because they're fully vertically integrated. The second long-term option is brand. Coca-Cola is a $300 billion company. Bernard knows the 8th richest person in the world. We're yet to know if brand fully works in health, but I do think that brand is a long-term opportunity. And the third is, how can you become a platform in the long term? Right? And becoming a platform means two things. It means aggregating demand, so you actually have people coming to you first, and then having horizontal supply. So they're no longer coming to you for one thing, they're coming to you for multiple things. So the secret formula for consumer longevity is this again, which is find some sort of product that you can grow in the short term and win with the right choice of product and really good marketing, and stack multiple of these bets on top of each other for long enough to vertically integrate and trench as a brand to become a platform. So let's have a look at a case study with Superpower, and then we'll move on to the biotech side. So what's our long-term vision? Well, you can think of it maybe as three things. One is we want to be the consumer front door. We want people coming to us first. We want to be a platform. As resonant as Nike or Apple, right? We want a brand. And with the highest quality and the lowest price. And the only way you do that is vertical integration. So that's the long term, right? And you have to ask, how do you do this? Well, the main constraint is scale. To become a platform, you need scale. To have a resonant brand, you need scale. To vertically integrate, you need scale. So we have to ask the question of, how do we get to scale? And the reality is, if scale is the goal, if we just have a product and just have an amazing product, but we're not growing, we don't have scale, and therefore we can't reach the long-term vision of being a consumer front door with a brand as resonant as Nike or Apple with the highest quality and lowest price. So we need scale, and that means we need a way to grow quickly. So we get back to this formula, and we need to choose a product that is conducive to making that formula come to life, right? And we're always within Superpower saying, here's growth, and what are the 10x changes we can drive by modifying product. An example of that for us was moving from a $499 a year price point to a $199 a year price point. And that was half the price and twice as good as most other companies in the market. We do 2 times as much at that price for 2 times less. So the formula again. And I'd contend that every one of these companies has applied this formula. And it doesn't look like it on the outside. If you read their document, and here's how we succeeded online, they might not share this, but if you dive deep enough, I'd contend every single one of these companies at the core, the foundational level, has followed a playbook similar to this. So that's consumer longevity, which I said is one category in longevity. You know how much I love that word. There's also biotech longevity. So we'll quickly explore the playbook there. And step one in the short term is pick a specific diagnostic or therapeutic, perform discovery or development, sell to pharma for distribution and commercialization. That's like the general biotech playbook at a high level, and that creates certain risks. You have a market cap size risk, right? You're relying on pharma. You're exiting for $300 million. Your patents expire. And then you have a risk of the diagnostic or therapeutic that you're betting on become obsolete. You have all the sciencey people point at consumer and say, consumer's really stupid. These guys don't have any IP. They're just rappers. And the reality is it might be stupid, but at the same time, the risk of the biotech side is that your diagnostic is not as good as the other person's diagnostic that is being developed at the same time, and therefore everything you do is obsoleted. So we have to look at what's the long-term opportunity, how to get through those risks. And I think there's 2 general options for the biotech companies that have become very large. One is become a platform, right? For example, become a discovery platform, perform discovery not for one therapeutic, but for multiple, often with a similar underlying modality. Or 2 is vertically integrate, actually become pharma and own distribution. And we can look at Moderna as a case study here. 2010 to 14, Moderna was, we have this thesis around mRNA. Let's perform discovery of different ways of using mRNA in therapeutics. Then let's develop it. Phase 1, 2, 3, investigational new drug, human trials. Then manufacturing. We think manufacturing is not precise enough for lipid nanoparticles, which we need for the delivery, therefore let's own it. And then phase 4 is distribution. Moderna said, rather than selling to pharma, we will become pharma. So I think that's really the pathway through for biotech. So the formula looks a little bit like this. Start with a therapeutic or diagnostic, prove it out, right? Discovery and development, and then either you can sell to pharma or become a platform and vertically integrate. So that's the end. 2 small things before we wrap. Number 1, we're going to give out some Superpower hoodies. Who here knows the story of the Superpower hoodie? Hands up. Okay, not many people. Cool. So one of the one of the things we did for marketing early in the year, we tried to do viral marketing drops that play with culture. And one of the things we did is we said clothing is harming your health. It's made from polyester and synthetic fabrics. It's an endocrine disruptor. So let's launch the world's healthiest hoodie, fully organic cotton, algae-based screen printing. We put this online, healthiesthoodie.com. They sold out in 10 minutes, and people relisted them for $2,000 on eBay and Grailed, which is pretty cool. And we have some hoodies here. So because we want to break the rules of the conference, we're going to throw them into the crowd. So.
Toss your hands up. You toss them
Cool. Now, you can resell it on eBay for $2,000, or you can hold on to it, because if we're a vertically integrated platform and brand, it might be worth more than $2,000. And then the second thing we'll leave you with is Superpower usually is $199 a year. For people here today, you can get it for $149. I know I didn't really step through what Superpower does, so you can find out more at that link, the QR code link or the link underneath. And the gist is, for $199, we'll provide someone with 100+ blood biomarker tests at the start of the year: hormones, inflammation, advanced cardiovascular health, toxins, liver health, inflammation, nutrients, full stack. We'll pull all of your data into one place. We integrate with the EMRs, we centralize it. You can upload your past labs, and they will automatically visualize. You get 24/7 access to a medical team, right? So you can literally just pull out your phone and text your medical team. You get an AI protocol that is really good. It's like we used to use doctors for it. Now the AI far surpasses what doctors can do. And then you get 20% off everything: all supplements, diagnostics, pharmaceuticals. So that's Superpower, $16 a month, $199 a year, or $149 for you lovely people. Thanks, everyone.